Hey everyone, Nicholas Fairbairn from Oilsome here, and today's subject is what is proactive health. I'm just going to go into it and try to keep it as simple as possible. There's two healthcare models currently happening right now in the world. There's reactive and there's proactive. Reactive is waiting for something to happen, then reacting to it. So for example, we wait till we get ill, feel unwell, don't feel so good, and then we start reacting when the problem gets painful enough for it to start to affect our day-to-day life. So that's a reactive healthcare model. Proactive is starting to look after ourselves proactively. So doing things on a day-by-day basis to keep us well so that we don't go into a reactive healthcare model. We still know that sometimes we will go into a reactive healthcare model when needed, but majority of the time we can look after ourselves and prevent us from going down that path. So proactive is, in my opinion, a far better option. I've been down the reactive healthcare model. So for those of you that don't know me, I've had glandular fever, which is mono, and pneumonia in the past. So I had to wait till I got that sick before I decided to make some lifestyle changes. And it was a very, very expensive journey and a very dark journey and a very hard journey that I really don't want anybody ever have to go down, because it's such a dark path that a lot of people may not be able to make it out of there. You're physically exhausted, you're mentally exhausted. There's so much happening that it takes a lot of courage and a lot of strength to get back to the basics of health. So proactive healthcare is starting to do things that keep us healthy. So using the basic foundations of health, of relaxing, moving, nourishing, enjoying our life, seeing what we can do so we don't go down that path, and owning that we have the power to create our health and wellness. I think that's a really big and important part. So we have to tap into ourselves and figure out what makes us healthy, because everybody's an individual. So by doing things to nurture ourselves, to nourish ourselves, to move our body, and doing things that help us to enjoy life, it's pretty hard to be happy and sad at the same time. It's pretty hard, well, it's impossible really, to be healthy and unwell at the same time. So what we're doing is we're investing in ourselves on a daily basis, and looking after ourselves on a moment by moment basis. So if we need to take a break to relax, we do that. If we need to get out in nature, we don't wait a month before we go camping or whatever recharges us. We do it when it's needed, and we proactively do it before we go into a reactive state. So I guess that's my explanation of proactive health. It's why would we do it? It's cheaper. Life quality is so much better when we're in proactive healthcare model, and it's more fun. Life is more enjoyable. Yeah, life becomes this amazing thing that when you have control of your health and wellness. And the thing is, once our health and wellness goes, it cost me $100 grand to get back to where I am. I couldn't work for so long. When you are ill and unwell and down and out, it takes a lot of energy to bring you back. So let's start focusing on ourselves and being proactive so we never have to go down that path. So anyways, Nicholas Fairbairn from Oilsome. Hope you have a fantastic day. And if you've got any comments, comment below. And if you think anyone can benefit from this video, share. Peace out, everyone. Love you all.